Okay. So the first picture will be this screening Ivan from UTAR.
Hello, good afternoon. So we'll be starting on the presentation. So this will be the outline of today's presentation. So let's talk about the anatomy of the lung. So when we breathe in, the air will flow in through our nasal cavity. That's the point through the nasal cavity, then go into the pharynx, and go down to trachea. This will be the upper respiratory. Wait now. Now, can you see the point out here?
There is a pointer there.
Yeah, so when we breathe in, we go through the nasal cavity, our nose, going through the pharynx and to the trachea. This is our upper respiratory tract. And then we will go down to the bronchi, to the bronchioles and the alveoli. This is where our gas exchange occurs inside the lungs. So when we breathe in, our diaphragm, which is the muscle below the lung, will contract, and the volume of the lung will increase with decreased pressure, causing air to go in. Then when exhale, everything will relax, the volume decrease, pressure increase, and the air will breathe out. So there will be lung volume and lung capacity, which refer to the volume of air associated with different phases of the respiratory cycle. So there's 4 types. The total tank for an adult male is about 6 liters, for a female is about 4.5 liters of air. So this is the diagram for lung volume and capacity. When we normally breathing, it's about 500 milliliters of air. This is the tank volume. So when we inhale forcefully, we can make up to here, which is the inspiratory reserve volume. When we exhale forcefully, this is the expiratory reserve volume. So after you exhale forcefully, there's still a residual volume left, which is the residual volume. So when this is restricted, it's causing a lung disease. So we're testing with the gadget here is that about all this expiratory reserve volume. So at the alveoli, which when the gas exchange occurs, the oxygen will be taken by our regular cell and the carbon dioxide will be diffused out. So this is the top 10 leading cause of death in Malaysia taken in 2023. For lung disease, pneumonia, which is the lung infection, is the first, which accounts for 15.2%. Otherwise, is lung cancer at number 5 and chronic lower respiratory disease. This is what we will emphasize on today, the chronic lower respiratory disease, which is the 6th leading cause of death in Malaysia. And which is COPD, the chronic obstructive lung disease, is the prevalence of death for this is currently increasing, which raises a concern and lead to our talks of today.
Now it's a goal. Eject will give the second part about signs of lung diseases. Going to be presenting about signs and lung diseases. So generally, lung diseases are called conditions of breath, breathing, chest pain, discomfort, cyanosis, clapping fingers, and frequent respiratory infection. So wheezing indicates that you have abnormal sound when you are breathing, and when cyanosis means that you have fluid discoloration on your fingers and around your tongue. So different colors of sphincter indicates different thing. So color of sphincter indicates mild allergy, viral infections. Green color of sphincter might indicate infection, while red color means that you have lung injury or malignancy. Will be lung disease also. So talking about early signs that you have to be noted about, which is system call for at least 3 weeks, more than that also, and then journals of even with lung activity. So frequent other chest infection and bronchitis is also a warning sign, and unexplained weight loss and fatigue. So there's different types of categorization in the lung diseases. So two types will be obstructive and restrictive. So for obstructive is basically restrictive is basically affecting your inhalation, which prevents the lungs from feeling adequate oxygen inside your lungs. So obstructive will basically affecting your exhalation, which your lung and the air is trapped inside your lungs. So the most common obstructive lung diseases will be COPD, which you all are spinning in front. So it's referred to a group of diseases results in aggressive airflow, blockage, and breathing related problems. However, what you mentioned, COPD is preventable and treatable. So there's two diseases under COPD, chronic bronchitis and emphysema. So emphysema results from the damage of the alveoli inside your lungs, which the air sacs of your lung, and then such damage of the alveoli results in decrease of breathing function, and thus you have breathlessness. So the damage of alveoli is irreversible and results in permanent holes inside the lung. So for chronic bronchitis, it's due to the long-term inflammation of the airways. When airways are inflamed, there will be an increase in the mucus production, then changes all the shortness of breath, cough, respiratory models. So resulting in the breathing problems, frequent infection, and also cough. So what to mention, COPD is the third leading cause of death globally and caused 3 million deaths in 2019 itself. So nearly 90% of the COPD that occurs in under 70 years of age and happens in low income and middle income country, which is our country. So Malaysia stated that in 2010, COPD is the fourth leading cause of admission in Malaysia, and they are expected to have higher risk of COPD because of the high incidence of smoking. And in 2016, the estimation of the prevalence of COPD in children and adults will be 3.4% to 6.5%. So talking about the risk factor and the cause of COPD, smoking will be the main risk factor and the cause. 85% to 90% of the smoker will have COPD is caused by smoking. The second cause will be cause, which you have long-term exposure to certain types of dust, chemical dust, organic or inorganic one, and chemical agents or fumes. The third cause will be air pollution, burning biomass, coal inside the functioning stoves and ventilator rooms. Although it's not very clear that it's linked to COPD, outdoor air pollution is also associated with decrease in lung function. So the last will be genetic deficiency. If you have a genetic that you have a deficiency in the alpha-1 antitrypsin protein, you also will be more prone to COPD. So the signs and symptoms specifically for COPD will be increasing of breathlessness, of persistent chesty cough with frequent chest infection that will cause you chest pain, coughing up blood, system wheezing, barrel chest, dyspnea, shortness of breath, breathing through the pursed lips. So a very brief management of COPD, which you still need to consult your doctor. So stage 1 will be you have to increase your movement and exercise like walking, biking, jogging, or those. Eat a nutrient-rich diet. Avoid triggers like mold, dust, and perfumes. Stage 2 will be join the stop smoking program, which is very important, and attend groups like this. Focus, manage symptoms, managing all the symptoms. Stage 3 will be start your pulmonary rehabilitation program. This breathing exercise, stay as active as possible, even you are breathlessness or those severe symptoms. Stage 4, quit smoking, including the e-cigarettes. So continue management as the stage 3 and see doctor regularly. So the next thing I'll be talking about is interstitial lung diseases. It's a rare disorder, and then it's characterized by inflammation, and subsequently your lungs will be scarred by bones, causing the interstitial and affecting the interstitial and scaffolding of the lungs. So the normal lungs, the interstitial will be thin, so the oxygen and the carbon dioxide can get gas exchange. So in interstitial lung diseases, the interstitial will be damaged and will be fibrous, so it will be weakened, then gas exchange will be inefficient. So it's caused by idiopathic, which we are not very sure of the cause. The second cause will be connective tissue diseases, autoimmune diseases, exposure, drugs, infection, and smoking. Symptoms specifically are different from COPD. It's a dry, persistent cough instead of symptom cough. Difficult, progressive, especially with activity, extreme tiredness and weakness, no extreme weight loss, and also chest pain. So very big than what you need to do when you are suspecting that you have interstitial lung disease. You will be expected to ask medical history, your family medical history, your current job hobbies, past and current medication, and you will be expected to complete a physical examination, spirometry, pulmonary function test, and a CT scan of the lung, of the test, right, and the blood test. So there's different type of causes of interstitial lung disease at times. So different types will determine different type of treatment. So need to be discussed with doctor. And in some case, certain medication also can slow down the disease. Occasionally, lung transplant is also recommended, and treatment options should always be discussed with the doctor. So the last thing that I'll be talking about is quit smoking, avoid secondhand smoke also. So smoking narrows your airways and cause chronic inflammation. So increase the risk of lung cancer, COPD, just now I said. So worth to mention, second-hand smoke is also very serious. Also leads to infection and chronic diseases. So benefit of quitting will be the risk will increase over time. So exercise regularly is also very important. It boosts your lungs and heart function, increase your oxygen delivery to all your muscles over time, reduce the shortness of breath during exertion, and helps your lung become more efficient. So annual medical checkup is also very important so that we can prevent undetected lung diseases, detect your symptoms early, even before they are worsened. So discuss any issue with your doctor. And then vaccination. So against influenza, COVID-19, pneumonia, RSV, which is very common nowadays, and reduce all the risk of severe illness, especially important for lung diseases, as they are more prone to lung diseases. So vaccine also help to stop the spreading of infection to other people. Another thing is practice of deep breathing, strengthen your lungs and breathing muscle, improve lung capacity, and stress management. Also, a better gas exchange also. So this is everything. Thank you.
What's the difference between a dry cough and a wet cough?
Very good. Dry is dry. Nothing come out, but there's a cough, right? Wet is productive, that means there's phlegm. We produce mucus. So when it comes not normal, it's phlegm or sputum. We call it mucus, all of us produce. But because we produce very little mucus, and then we will usually swallow it because mucus helps clean the airways. So when there is excessive production of the mucus, this phlegm, the sputum, you will need to top it out because swallowing won't do. You have this sensation that there's something down there is coming up. So you need to expel it by coughing. All right. So dry, really, or very little, the mucus is dry, especially so with interstitial lung disease. Interstitial lung disease presentation is dry cough. TB presentation is also what is we call in Malay? What is it?
Batuk kering.
Exactly, batuk kering. So the Malay word is actually batuk kering. So it's dry cough. Initially, TB is dry cough, persistent. So any cough more than 3 weeks in this part of the world, we would like to examine the sputum of TB. 3 weeks, okay? So that's the thing. So wet is wet, it means there is some production. So when it's wet, then the best thing to do is to note the characteristic of the sputum. So very often I will ask my patients, right away, don't show me in a piece of paper all the sputum and all, a bit not messy, it's a bit messy, so I'm clean. So take a photograph. Take a photograph of the phlegm, and when one visits the doctor, photograph, because everybody has a camera now. And your handphone has a camera, take a photograph. So by doing photographs, also they ask people to take photographs. So can I see your student when I come for the next visit? That kind of thing. So when we see, we look at the describe color, the amount, or sometimes smell it, like it can be sometimes very awful, those anaerobic kind of infection, various mouth swelling, even the mouth is foul, those are lung abscesses and all this. So we look at it. So different colors, remember?
Yeah.
Clear is good.
White
Yes.
virus.
Clear is from the virus, yes, virus, but usually if it is an infection, usually it would have some color. But viruses can get clear, band, sometimes even dry cough. At the beginning, later of course, usually it becomes wet because there's airway damage and lung damage, usually so common. Except interstitial disease, they can persist for weeks and months with just dry cough. Cough, right? Yeah.
So when the cough goes away, does that indicate that your lungs now have returned to health?
Yeah, if the symptoms of lung disease as mentioned disappear, then obviously it just could be a acute infection of some kind, common cold. Because cough not only is from the lung, it's from the upper respiratory tract. What causes cough? What causes cough? It could be from the nose, could be from the throat, could be from the airways, and then going down deep into the air exchange space. All right, so the whole tract, respiratory tract starts from the nose, remember, from the nose right down. And important causes of cough will be nose, posterior nasal drip, nose allergy causing, call it posterior nasal drip, it means the nose, the flank dropping down, and usually throat clearing, kind of thing, throat clearing, all right? So, yeah.
What does itchy throat causing cough indicate?
Yeah, usually due to some inflammation, itchy, and then usually inflammation, and the inflammation usually produces a little bit of this extra amount of mucus. So, it's so little that it irritates, but you feel that you don't have that.
No, it's
Spit out, you don't really spit out, but you actually swallow it.
Yeah,
It's a time to swallow it.
swallow it,
All
right?
right, yeah. Any other question? Yeah.
And phlegm caused by stress, because I noticed when I go for, let's say, stressful trips, I can frequent this phlegm, that I don't cough up. I just, that you say, swallow it, but it's big, it's not a major medical concern. Maybe it's a bit unpleasant to my relative, say why you still grow, right? So they give me some candy, So I was wondering, is that the way to solve the issue?
Okay,
Or drink more water. I don't know.
yeah. So when you exercise, if you haven't been drinking enough water, obviously you get cough. Then because it's exercise induced asthma. Exercise, it only comes on with exercise. Because you're wheezing, cough,
The flanks.
very little phlegm, very sticky phlegm, very sticky phlegm. So it could be because no water, you have to exercise with water, yeah. Those are the common. But if it disappears after the exercise, no alarm.
What happened is dry cough, but it did not persist, only at night.
Right. That's a nocturnal cough. We have to look out for allergies, especially nocturnal asthma or bronchial aneurysm. Because sometimes we don't realize, but when we get to our bed at night, it could be the allergens in the house, in the bedroom, especially what is very common in this part of the world. People are allergic to pollen. Pollen the room not so common because how does mites? How does mites? It's actually a living thing, It's not an inorganic thing that's dust. How does mite is a living organism? It is very tiny. You cannot see it with the naked eye. You cannot see it on the day. It doesn't bite. But what happens is that it feeds on our dry skin that has dropped off. So it feeds on that, it's very tiny, cannot see through the microscope, and then it's excreta, the shit is that, we breathe it in, and that causes the typhoid, yes, yeah, even asthma, sometimes itch, sometimes, yeah. So if you are allergic, not everybody is allergic, how does my, but if one is allergic, then the not,
What's the best way to get rid of these bugs?
that's right, oh. It's not easy. Feeds on scale. Our those guys say skin, skin, okay. So they are everywhere because you some of the big, we have got jungles, the scale. So we go to the sofa, we in the sofa, alright. So we treat every. So at least if one is allergic to this, how does like is to reduce its population, alright? Yeah, because most of the time when you are in your sleeping 7 hours, 6 hours, right? So you are facing them, you're facing them. Of course, you don't think also you don't slow their name. And you're breathing in, so your mattress, the pillow, everything has to be pretty clean. All right. Now, those washable wash, hot water, and then dry, very hot. Those who can't, like a big mattress is so heavy, you take a good vacuum cleaner. That vacuum cleaner need to have
Filter,
filter, like special filter. So those machines will be $1,000. Expensive ones. So you put $300 machine, you took vacuum out of those way. So because they haven't got proper filters. So the filters will be the HEPA filters. Not good enough. It has to be a HEPA filter. So if you're really allergic to the house dust mites, really need a plumbing gun or aircon to clean, your curtains reduce, your carpets no more, your rooms really clean. Really clean.
So on average, how many times do we need to wash our bed sheet or anything? Every month or what? I wash about every month once a year.
The change properly because we have a that is everybody is called as the okay, test. When you get test, do a blood test, a lung test, to see whether one has that, the last test, to see whether you're really allergic to the house spike. So it's very simple, do a blood test. Yeah. But the blood test will come cheaper. It's $200. Yeah. Any more questions? Yes.
Chinese TCMs,
TCM.
that sometimes they say tea on the phone. What do they mean by that? Do they mean our pH value or not?
Answer your own Sure. The duniya में रहा है ना ये
Nowadays, I like to go for this TCM thing. I think UTAR also they have like something like TCM and modern medicine.
That's right. Yes. You ask them, you don't have that kind of ideology. Any more questions? Yes.
Chinese cordyceps.
Cordyceps, yes.
Some evidences for lungs.
Yes. I think you can try. If everything else doesn't work, try. Yeah. That's right, cordyceps.
With cordyceps.
That's right. Yeah, I think it's some medicine will work. Some English Western medicine are also from herbs. So it does work. So they have tried ancient China and tried that, so they probably does work. So when the patients tell us that they are taking cordyceps, say go ahead if you don't for you. Go ahead.
Cordyceps.
And this is the first cordyceps.
Very expensive.
Yes.
Yeah, they're very expensive.
Exactly. Yes.
Maybe about 5 or 6 times. Quite a lot of
Yes.
Last time you can get a packet like that for 180.
That's right.
Ringgit.
Yes.
Now a little bit. So, all the pharmacy are tablets. But nothing like one mechanism.
Any more questions?
That's all.
Yeah.
What are the early symptoms of pneumonia in seniors?
Okay. So pneumonia, yeah, is very common among seniors, I think. So the important cause of mortality actually, because seniors don't breathe deeply, and sometimes if they catch a cold, it will go down because of reduced immunity, and sometimes it's diabetes and whatnot, other things, So yeah, very common. So presentation cough, initially will be cough, or later becomes red cough. Usually the symptom will be colored. So that's color, yellow or green, sometimes if they pop up blood, but those pop up blood will be very big, very big. So fever may or not have. Very elderly people will not have a cough. Cough, sometimes your cases, in fact, many cases, very little cough are pain. That is because that part of the lung infected has got the pleura involved, the membrane of the lung involved. You get pain.
Where is the pain?
Anywhere, depending on which segment of the lung is infected.
Pain is
Any part of the lung.
in the area of the rib cage.
Anywhere, if it's this part of the lung, this part of that pain, that part, yeah. Whichever part of the lung, but usually the basis, usually the basis, So cough, then fever, you may not have all of them together, you have this, not that, this, not that. Pain, all right? And if it becomes worse, obviously, breathlessness, and then you can have to get treated immediately. Because remember, germs at the very beginning, if you got one germ enter you, it becomes two. Two becomes four. Multiply, right? Four becomes six. So when it is late, 1,000 becomes 2,000. That's why sometimes things can mature very fast. And it depends how fast it will mature, depends on one, your immunity. It means the younger you are, the better the immunity, older, the worse. Diabetes is one of those. If one has diabetes, more likely to have a problem, and the germs. So if I'm having an infection, I'm talking to you, and you're very close to me, and this lecture is 1 hour, you're getting a huge amount of germs into your body, and that is important. All right. Yeah. So those are the factors, and of course, finally, the virulence of the organism. If the organism is very virulent, very powerful in that sense, it will not come. So many factors here. Many factors.
Is it true that the symptoms, pneumonia symptoms in seniors are very mild?
Yes,
So
it's
it
very mild.
can be mistaken for cold,
Yes, can be very mild. Very mild. Especially diabetics.
especially
Diabetics.
for that.
People with diabetes, yes. The symptoms could be very mild. Maybe a slight cough, and then during 3-4 days deteriorate again. Because the immunity is low. They cannot mount the proper
Immune response.
immune response and attack against the germ. Yeah.
Sometimes they also speak that they cannot cough very strongly.
Exactly. Sorry. Yeah, so you cannot mount the proper immune response.
So you want to prevent pneumonia, use my S company product, pneumococcal vaccine.
Well, so,
You can prevent pneumonia.
Yeah.
Now, you say vaccine.
Yeah. Pneumo 23,
What vaccine is that?
pneumococcal vaccine.
vaccination. So I think for lung health, exercise very important. Deep breathing, very important. Exercises very important. And then if any symptoms, see doctor, get your vaccines. All of them.
Remember,
Yeah, COVID,
any anti-COVID, anti-vaccine, yeah.
COVID, influenza, pneumococcal, and the new one is the RSV vaccine. The RSV vaccine, respiratory syncytial virus vaccine, right? That is expensive, quite expensive. It's about $800. It will last.
Do you say?
There's one vaccine called chickenpox vaccine. actually they prevent the, what do you call that? It's not for chickenpox, no?
Shingles.
Shingles. Will it help to have right? Huh?
Not for now, not for
Not for, yeah.
You know, for
Yes, basically get,
yeah, so every 5 years.
if you are young, 5 years old, if you are person 65, once your lifetime.
Yes, you
Huh?
if you are a senior,
Once a lifetime.
One time.
One time.
Yes.
What is the difference with the RS? Seven to an immobile.
Or the different organism, because pneumococcus is respiratory RSV. Just the COVID is COVID, very specific. There's hardly any cross
The, what is this protein?
RSV virus. Respiratory syncytial virus. Yeah, they can cause pneumonia. They can cause pneumonia, yes.
is the same as the pneumonia,
No, no,
it's a different one.
it's a different virus. Pneumococcal is actually a bacteria.
Bacteria, yes.
Bacteria. The RSV is a virus. Virus. It's like a-
We talk, we seniors.
We recommend seniors and those younger with comorbids.
Oh,
Yes, younger with diabetes, especially diabetes.
I have the word in RS.
RSV, R, Russia, S, Singapore, V.
Vietnam.
Vietnam, yes.
And the doctor just one question. People don't measure obesity is
Yes.
a problem. Will that, is that, a factor in COPD getting worse?
Okay, and, okay, obese people. So, two particular diseases straight away, one can usually, try to illustrate will be the obstructive sleep apnea. Obstructive sleep apnea. And of course, the other one will be obesity hypoventilation syndrome. And these people are more prone to infection. So, obstructive sleep apnea, hypoventilation syndrome, and Wheeler hypoventilation syndrome. And yeah,
Does obesity also affect COPD?
no, no. You see that because the COPD is the airway. You see it's a problem.
It doesn't cause them to have breathlessness.
Because not airway level, but because they cannot expand their lungs properly. Because the tummy, as tummy grows bigger, the lung when they breathe cannot expand fully because this is actually sort of tanking the lung. So the lung cannot because this is too big. That's why when you breathe, you find that your you know how to breathe, right? How the chicken people breathe, you know how the chicken people breathe, right?
Chicken,
Like a baby.
Like a baby.
No, it's like you have to be sing like small.
Tummy out, yoga.
Tummy out.
Tummy out, yeah.
No,
Yeah. They breathe your tummy.
Yes.
Breathe your tummy. Not through your. Then just
To stay healthier and when you breathe in, no, really about when you breathe
Exercise.
out, because exercise.
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 So I have asked question. Just not you measure. I saw the slide. Now the exercise is very good to sort of help, prevention, management of the COPD. But there are different exercise. For example, like I like to swim. Like if you compare swimming and let's say jogging, which one is better for lung health?
Both of them can.
It's the same.
But you must push. When you exercise it is a way to get maximum benefit from exercise. Like I'm walking here, it is not really exercise. You know what I mean?
Walking is not exercise. I love to walk and run. Huh? Because they say 6,000 steps, 10,000 steps a day, Not really.
6,000 steps is correct. It's not really the exercise that the real exercise one. For the real exercise, you have to push yourself towards the target heart rate. Target heart rate. So when you walk very gradually, the whole supermarket is a mall. We walk 6 floors up.
6,000 already. Now already.
6,000.
Sorry, 6,000. Go shopping.
Leisurely pace.
Leisurely pace.
You don't get the maximum benefit. You know what I mean? So to get the maximum benefit, you really need to put up to the not the maximum, the predicted 80%. 80% of the maximum heart rate.
I have a bicycle at home.
Yes,
So if we cycle, how long should we do this?
okay. So when the bicycle station message goes, so you look at things. You need to monitor your heart rate. All right, but there's some bicycles, station message have this, how you monitor the heart rate, right? Yeah. You can buy a pulse oximeter and just do that, all right? So you need to push yourself to 80%. That's your target heart rate. You don't go to 100%. Your 100% is, you know how to calculate it.
I have no idea how to calculate.
Your maximum 100% is 250 minus your age. So please not try to calculate age. Everybody like to calculate age.
220 minus the age.
Yeah. Minus your age, what's your age?
220 minus
Your age, okay, so you have 250 minus your age.
62
Yeah, so 80% of that. 80%.
times
80%, right? So 80% is your heart rate.
one.
Okay, so exercise to get the maximum benefit, you must push it for at least every 15-20 minutes continuously. That means to maintain your target heart rate for 15-20 minutes, and then you get the result. And you try, come down, go up, come down, go up, come down, go up. But you must try to reach target heart rate. Because if you don't get the maximum benefit. So what happens to our patients with lung diseases? Well, often they come to us breathless, right? So because they're breathless, they're very scared to exercise, right? So they need to move their breathless. So they tell them, when our patients with lung disease come, we tell them, go exercise. Go exercise, you must exercise, then after exercise. This guy will tell me, tell me I'm stupid. I don't exercise.
What exercise?
Exactly. So the question is actually, so they already have abnormal lungs. So when they exercise, if they walk off too far away, they will have difficulty breathing. So we need to still push them until they feel a little bit breathless. And then we tell them to stop. Get back your breath. Push the music a little bit breathless. Well, I don't know. So that you and I know when we do our exercise, we have this, okay, so you got to reach that stage. And then we will ask them to slow down, get back the breath again. So when people you have a full breath and the oxygen desaturation, let's say oxygen falls. Okay, oxygen falls during the exercise. So what happens is that we will tell them to get oxygen concentrator. They use oxygen concentrator, switch it on, so that they can exercise further before it gets breathless. The advantage then, the muscles of breathing will be strengthened. You know what I mean?
Oxygen.
Oxygen concentrator.
You buy the
Concentrator.
You buy the table size kind of machine. And we will you come to power
concentrate.
Take on the air, remove nitrogen, and you get oxygen.
Must be expensive, but
That's all. Then about 3,000 to 5,000-6,000 depends on what model you know.
There's a little bit breathless means you can still carry on the conversation while we are
Absolutely.
exercising.
Yes, please do. You are definitely participant. No?
It means if you are breathless, it'll be hard to carry on the conversation, you know, like.
But all depends on that first. Depends on how that. Right. So sometimes Asian people will just say you have asthma very bad. They're talking how you know they talk continuously. If you don't stop, you don't want me to do that, right? Okay. But you know, if you're getting better how they go, yes, you are going to have a nice meeting today. The meeting has been for 1 hour. And then it was already, their business already developed. Use your most, your And that was very bad relief. You know, when you pour so much to get your breath, you can sense so many patients when you talk to them, you roughly know how bad that breathlessness is. It's because it's the pause. If they cannot finish a sentence, one word, and obviously, breathlessness is there. So there's one how we gauge, correct?
What is the best sleep position for seniors? I've often heard that if seniors sleep flat, it's easier for the lungs to get flooded with fluid.
That.
Huh?
On the back.
Oh, okay, yeah.
In the back.
Okay, there's no recommendation to both people, but this way that we no
Looking for
obvious.
seniors,
No, no recommendation. But because if you got COVID, when you ventilate them, we go or lateral because then because of this stasis, the blood flow and the amount of ventilation, we do position. We do position very bad numbers, we do position. But normal people
what position?
positioning, when we're ventilating these people, we either this way, that way, or
Will change.
yes, and change position every box. Then we get the benefit of the ventilation, we get the lungs very well ventilated. COVID is one of those examples that we actually practice when they have very bad severe COVID. Yes.
When exercise jogging, because of practice, is cardiac problem or lungs problem.
So it's all, everybody will get jealous of that. So
Jogging before take the nap,
no, if we exercise hard enough to our maximum capacity, we will be at least slightly short of breath. Yes. Yeah, even Olympians, when they exercise, you know, they could see people swimming, right? What is when but they cannot. It's normal, all right? So, as I mentioned, your target heart rate, all right? But even if you don't reach your target heart rate and you're already breathless, something's wrong somewhere. Something is wrong somewhere.
For elderly, is it necessary to take two or pneumonia injection? For elderly, is it necessary for us to take two or pneumonia vaccination?
All suggestion will be all that is available.
Is it necessary?
Recommendation is all, unless you have contraindications, recommendation is all.
Is it time free, if you have taken, you have vocal, you have to wait before 15 hours?
Well, I used to usually wait at least 2 weeks, because sometimes 2 months, 2 weeks, at least 2 weeks. Because, well, because when you sometimes you want to see whether there's any problems with allergy and all this there. And also because they found a immune response. So after the injection, they get because they're actually fighting whatever entered into the body, you know, your muscles initially. So they mount immune response, so you want to rest. Just like you exercise very hard, right? One whole day working very hard, tomorrow must rest. Exactly.
So the pneumonia vaccine is good for a lifetime.
Pneumonia vaccine, if you're elderly, otherwise it's once in 5 years.
But it's good for a lifetime. And elderly means 60 and above.
Yeah.
Good for a lifetime.
The pneumococcal vaccine does not protect against viral, because pneumonia can be caused by viral. So a lot of misconception, they think that take the vaccine, you prevent all sorts of pneumonia. Not really.
Only the
Only bacterial pneumonia.
only the specific bacteria.
Yes, specific means
A lot of people don't have.
even if they are vaccinated, you can still get pneumonia.
Absolutely. There's so many germs in food. So many germs. So the best, the best for people with lung problems, or at least healthy people, that the government or the YouTube says there is infection here, very high incidence of COVID, you better wear a mask. All right, so it's prevention. At least you don't, when you go into areas which are crowded, you protect your mask. All right. Yeah, that's why I'm still serious wearing mask and everything. Yeah.
I had a friend, his wife had four Jack. And one day she was walking, she just dropped it.
For COVID, then? Oh.
So after that, I trying to do some searching what other people have experienced. And they found that worldwide, there's been a lot of people after taking the COVID vaccine. And actually, what happened to my friend's wife? Just they are walking, talking, then suddenly the wife just dropped in front of him, So he was he couldn't believe it. It took him a long time to get over that fact and that picture in front of him.
No symptoms.
Nó bắt cái mùa mùa rồi mà cái hẳn đấy thế chỉ just suddenly drop
Thanks up. Coffee là cái gì cái nó phải quen.
that time he went to do some local research so that this sort of incident has been reported all over the world.
Yes.
After COVID.
Absolutely.
When you have so many recurrences of this, you start to wonder. And then someone sent me an article about Pfizer being sued because this vaccine. Some researcher came out and said that this vaccine was never really proven, but Pfizer said to be safe. So now Pfizer is having a big suit on their hands. They must really go bankrupt because it's a worldwide thing, you see. And how many millions they make out of that vaccine, but how many people die?
Vaccine is less than 20 years. So this is what I call that. And I'm saying it's new, but if you don't take it, what about there are more risks? So it's better of like no risk, risk.
But the thing is, doctors, most of the time, when they want to produce some medicine or vaccine, they do a very long-term testing and all that.
Yes, because COVID is an emergency pandemic, and there's a pandemic, there's to make it fast. If they don't make it fast, there'll be, instead of, 1,000 people die, there'll be millions of people die. You remember the flu, the Spanish flu from overseas? So many people died because of the flu. Then the world war combined. If we have come up with vaccine, there will still people die less. So the moral story is, if there's something to protect you, it's better than nothing. Although it is, risky because it's not proven. Experimental,
It's a mRNA vaccine. So it's the first time they used it. Never tried this technology before. So far when testing they're done in the lab it's safe, but you never know long term.
Yeah.
But emergency mandate. Nobody can sue actually. It's emergency.
Emergency,
Even that, see what the paper comes out with this that they're having now. Because this thing is getting there, spreading all over the world. Blame Pfizer that with the advantage of the situation and how many trillions that makes some of these robots. And how many thousands of people died.
Yeah, when the company say before, nobody say thank you very much, thank you very much. When one of people die, people sue. This is not fair to the pharma companies. When you're saying
fair to the people who died.
then what about those what about those who survive? Because of the vaccine, you have to say otherwise more people die. They say you're supposed to 10, don't take the vaccine. But 3 of them died. Now you have 2 people died because
this is actually speculation we're talking after the booster dose. I mean, without the vaccination, maybe nobody dies. That is.
You remember that in India, there's no vaccine. So many people died in India. What the strain? The strain name? The COVID, the special strain, Delta or what? Delta, yes. Delta, people are so panicky. There's no vaccine, People are dying just on the road there, thousands. Would you like to happen in Malaysia?
No, they died of why are you saying they died of that?
They died from COVID.
No.
It's confirmed. Died from COVID.
Speculation. We died of COVID. Nothing else.
But the FDA was very strict.
Yes.
Now, within 3 months or so, they passed it back up. That's why a lot of Americans are getting very sore now. Because it's too short. Before, you have to wait 3-4 years or more to get a drug approved. Now, 3 months, 6 months approved. So they were fighting to sort of get once a week. Get more done.
Get the food.
It's done by
Yeah.
doctors.
Is there any evidence that ivermectin can help in the COVID stuff?
I think it's very controversial. I don't see anything to support.
I will like it. I took, I.
So does it help? Can you share? Do you mind sharing?
You anything.
Low dose. Where do you get the ivermectin? Was it online or?
No,
Huh?
yeah. And that's how because the government say cannot sell. So I had a friend who's a pharmacist and said, you go and get some now. Because he really want to try and I see I've heard of so many friends who have used them. So I said, why not? But what harm has it done? Just the vets use it. The vets use it a lot. The veterinarians, they use it a
So
lot.
it help you.
My whole family, nobody was suffering. They said, okay lah. They said, I don't.
But how do you know what dose to take? Like
No, I asked my friend, the pharmacist. I don't know. I took one a day or two a day, something like that.
for period of time during the COVID time?
No, I think I only took 2 weeks.
Oh, then it's good.
Because they found that the vets use it a lot on the dogs and and it helped them. So I was thinking, never mind, I'm not a dog.
Yeah, any more questions?
The animals will get COVID.
Okay, Leong, can you give us some tips how to improve your body immune system?
The body.
That's very important because if your body immune system is strong enough, I believe our body able to fight any small viruses or bacteria. So can you give us some tips for all those people how to improve our immune system?
Yeah. Okay.
I always thought that God made us in such a way that you have a natural immune system and your body can actually heal itself.
So very important exercise. Age you cannot do anything. We just grow. I mean, every day we pass by. Exercise. Make sure don't worry well. Don't worry. Don't worry. Don't worry. Down. It's not good. Eat well. So long. Eat good foods. Eat well. Exercise. Sleep enough.
No stress.
How much sleep is required for most of us here? How much is the minimum?
8 hours. Are you lucky?
Yeah. And this 6, 7 hours. You will be 7. Better if you can get 8. But if you cannot get 6 or 7, one go at night, you can stagger it. Siesta, a long siesta. So add all together, at least 6, better 7. 8 will be luxurious. Okay.
It's not good to take sleeping tablets.
Oh, never.
Sometimes I sleep 6, sometimes 7.
If you sleep more than an hour,
It's okay. Thanks. You don't get any hangover. It's okay. The minimum. If you need more, you sleep more, and you have the available time to sleep more, it will be very good. Yeah, that's it.
I think quality of sleep is more important than hours of sleep.
Hours of probably both. Both. The deeper the sleep, the better. Yeah. Anybody else? Yeah.
Yes, one more.
Yes.
Is it a good idea for seniors to sleep in a reclined position rather than flat?
Good recommendation unless one is common. Anybody with lung disease will be better sleeping and recline.
Recline.
In recline, that means anybody with lung disease. Because that will allow the lungs to expand better. Yeah. If otherwise, no. But of course, if one has a snoring problem, then supine position will be a problem because then you get more obstructive.
So fine, it's on the side.
Supine is flat.
Or flat. Flat.
Yeah. So if one is snorer, anybody snorer, anybody with big snorer, or big snorer. So I think if one is a big snorer, chances snorer, the wife complains or the wife sees the person stops breathing at night, observe and hear, that would be very dangerous to me. Very dangerous, you know. No sound. Then again, sometimes we start choking, choking the wings really blocked. That will be very alarming to the spouse. The spouse will usually drag the other person to the clinic because they see the person like choke, like stop breathing, like turning blue. Then it's very dangerous for you. So usually with supine positioning, right flat will be usually worse. Usually, but not always, but usually worse. So there will be a few things like and then the people who perform this a lot of cough and flare and all. So they will tell us, you know, if they sit in a particular position, more cough, more flare. So the advice will be for bronchiectasis. The bronchiectasis. We will do sleep at that particular position that has the most cough. To bring up the flare, once the flare is draining by itself, by coughing, then the cough disappears. You have to drain it because that particular position is draining the segment of the normal lung. You know what I mean?
Sorry.
Sleeping in a particular position is helping drain naturally via gravity of the problem lungs. Draining this. So we usually advise them to sleep place that they have the most cough. Cough until there's no more flare. And it's the best.
What causes fluid accumulation in the lungs?
Oh, many causes. Many causes. Many causes.
There's a big heart cause.
Yes, absolutely. Yeah. So that is pulmonary congestion due to some other disease secondary to something else. The lung problem is secondary to heart failure, liver failure, kidney failure, or fluid in the lungs could be something intrinsic to the lung itself, like pleural effusion. That means there's inflammatory fluids are accumulating in the lung. Yeah, or very severe inflammation of the lung. Fluid respiratory distress syndrome, that kind of stuff.
Can it be caused by overconsumption of fluids, like drinking too much water?
Of course, if one has liver disease, kidney disease, if you drink too much, you cannot come out, you will food in the lungs.
Water retention.
Yes, water retention. Those people, especially with kidney problems, they cannot pass out the fluid because the kidney is not able to extract from the blood to go out to the urine. So you should be
So you have to watch how much you
absolutely. So you have to fluid restriction, we call it fluid restriction. Yeah. That means you have to reduce drinking. And of course, medicine will check it out.
You drink more, but more times, but less now. More times a day,
more frequently.
but smaller amounts each time.
Really, of course, that's what a good gauge would be, you know, if you are normal, no kidney, heart, or nothing, normal person, you should sort of like drink until your urine is clear. You know, if it is very yellow, it's very concentrated. So it's at least clear.
The best indicator.
It's a very brown.
I was at a health camp in India a few years ago,
Yes.
before COVID. And there in the health camp, every morning, they start us off with drinking 2 big glasses of water. First thing in the morning, then 2 days later, 3 glasses. Then another few days later, to build you up to 4 glasses.
At least one shot.
Yeah, and it really helped me shut your system. And we felt so good after this certificate for 1 month. We wanted to stay 2 weeks, but the doctor then said, no, you can stay 1 month. So we decided that since you're already there all the way, and quite a number of Malaysians go there, you know, right? So we drank 4, and it really pushes you out, but you sleep very well at night.
Oh, there's a lot of water.
But be careful, because sometimes you don't know whether one is kidney problem or whether there's something known as water intoxication.
They have a medical doctor at every floor, and every day they send.
That's right.
We check up you and ask you how you feel and all that, so and how much.
Doctor, can you explain, because I heard one doctor, he was trying to lose weight. He went to this program and they told her to drink 3 liters of water a day. She said she walked out. And then she explained to us what will happen to your blood and all if you drink 3 liters of water, and it could even affect your brain. Can you explain? Because it dilutes the blood, is it all the electrolytes and everything are diluted, and it could affect brain. What should I say? What is your take on it?
Okay, if there's such a thing as water intoxication, that means too much water, body cannot flush it out as fast as you consumed it. It will cause all sorts of problems like dilution of the electrolytes that will be detrimental to the body. Right? It cannot come out. Because the kidney, as I say, you feel that your kidney is normal, but it may not be, because you see, just an example, you can donate a kidney away today out of your generosity for somebody who needs a kidney. And tomorrow you check your blood. Is it normal or abnormal? Huh? Abnormal. Abnormal. If you got normal kidneys, normal kidneys start with, if you donate one kidney away, tomorrow you take your blood, or maybe 1 month's time take your blood,
Wouldn't the kidney compensate if you have only 1 kid?
Exactly, you compensate.
But you have to work harder.
Blood test will be normal. Because you're too fast. Blood test will be normal. So you need to say, you may feel that you are normal unless you have checked yourself, or the blood test is normal. But if you extract it, you cannot function normal. That means you get problems like putting too much water in the patient because your blood test is still normal. You know what I mean? But because the two if one is still normal, that means a more extra reserves, but very, but if it's one of the most also like that, but it hasn't gone over the limit of the reserves, you can still function. But once you know, cannot.
I have 2 blood tests recently, and I took this to my doctor. We went through everything. What happens to you? I have cramps every morning. Only in the morning when I wake up. It's not so bad now, but it was very bad sometimes. So I went and told the doctor. Only last 2 weeks ago, I went back to more. We showed doctor, the doctor gave my test again. We went through everything here. The teacher is okay, this is okay, yes, everything is okay. But my cramps are still bad, but not as bad as before. But I result from the lab test, everything was normal. And every morning, even up to now, when I wake up in the morning, only in the morning, the rest of the day I have no problem. My cramps don't come. And at the beginning, when the cramps came, my toes were like this. Pull that out, and then stand up. Standing up so that it doesn't bend. So I'm just wondering that. And then here my blood test, says everything is normal. I'm still trying to figure out what is wrong with my body now.
Get a warm blanket, don't stretch yourself. When you get out on bed, don't stretch. The stretch will be first problem. Stretch. Good stretch.
I don't stretch it, but I meant that when the cramps come, then all my toes go like this. So I have to pull them back,
Yeah, usually it's somewhat preceded by a stretch. Maybe you didn't know. You don't when you get out of bed, often enough, then you'll get up. And you try to keep warm. Keep warm the legs.
I never had such an aircon.
All right,
So actually can The salt is like, don't like that.
Yeah, it's not, but it's, like I said, all
Salt.
the
Sea salt. That's right. Whenever I get the cramps, a friend of mine said to me, I take a certain salt, UTAR, hydration salt. So I have it at my bedside, and every time I have the cramp, I quickly add some water and drink, and then within about 2 minutes or so, then the cramps will go.
those will be exercise, and if you exercise so hard, the next thing you can get cramps.
I don't. The only thing I do is go on the bicycle for morning walk. I always do 10 minutes.
But at night, evening,
No, morning, early in the morning. After I walk, then I go on my bicycle and I'm back for 10 minutes. And I'm only on number 6. I don't go beyond number 6.
It's a good idea to do some simple exercises before we get up from the bed. Just to get the blood flowing.
all of us are quite young here. When you come out from bed, sit, stretch, stand, stretch, and then walk. Because you get from bed, straight away walk up to the class. So remember to do that, sit, and walk. Don't do fast. Because you cannot.
Take some time.
Yeah, it's a just an exercise, a stretch, not body stretch. Just a no simple stretching. Only to do exercise. But so remember stages before you move. Okay, okay, thank you very much. Thank you very much. Thank you.